What looks good on someone else may not work for you, and that's okay. And if you are uncomfortable with maybe your nose or something else on your face, you can change it or you can stay the way you are. It doesn't matter, but it's all about confidence, and that is what Dr. Ward and his team are all about. Dr. Ward, I think that's our favorite word to use, isn't it? It's about the confidence that you feel when you look in the mirror.
100%. Like, it is not about changing who you are.
No.
It's, in my opinion, should be about enhancing who you are and helping improve those parts of you that makes you really shine and be presentable to the world. It's about security. It's about confidence. It's about not looking at photos of yourself and being, oh, darn it, like I'm focusing on this one little part of me.
Yeah.
And it's something that I'm super passionate about because I've kind of devoted my career to the face and what makes us attractive and what makes us feel more secure. So it's a really fun thing for me to talk about.
Well, and let's be honest. I mean, we can all say that the world, Hollywood, they have messed us up because we do look in the mirror, right? And you're supposed to see a certain type of person or what's considered beautiful. But you always say we want to enhance that person. So let's just talk proportionally, though, when it comes to the face. If people are wanting, something done, where do you start?
Well, I think it all starts with the eyes and then a little bit to the mouth. If we look at studies that look at where our eyes go when we're communicating with each other, it's almost like 90% we look eye to eye, and then it's like 5% looks at like eye to mouth, and then the rest looks like other things on our face.
Okay.
The eyes are the window to the soul. So our job, I think, in facial plastic surgery is to enhance that, to enhance like what we can visualize of the eyes. So for example, my nose is a little bit bigger than what proportionally probably should be. The tip of the nose should roughly be the same size as the iris, the colored part of your eye.
Oh, interesting.
So, I mean, it's not hard and fast. It's not like if your nose is bigger than that you're like unattractive or whatever. But in general, that's what our mind expects to see.
Interesting.
Same thing with like cheeks. When we look at each other, we expect to see the light, whether it's sunlight, whether it's overhead lights, come down and hit our cheeks here with a little slight shadow right here. If it's the other way around, if I've got really full cheeks, it looks a little bit different. And our mind is so keen.
So powerful.
That it figures that out like instantaneously. It doesn't know why it figures it out, but that face is going to look a little less attractive to us, the one that's got the proper light and shadow effect.
So, and honestly, though, you can do things without actually having to go under the knife now, which is, let's say you're talking about the windows to the soul. Well, people can add eyelashes now, as simple as that. Right. You can add filler to your cheeks. There are very simple things to do to enhance that person's look.
Absolutely. And talking about the cheeks is really good because we do a ton of cheek filler. That's a really popular procedure now. And it's really important because it does help frame the eye. If you think of the eyebrows as the upper frame, the cheeks the lower frame, if the cheeks are too small, then it looks funny. But of course we can overdo it. And that's what,
Absolutely.
Everybody's fearful of looking fake, like the pillow face sort of thing. It's because we've added so much volume here in an attempt to make this frame look better that now we notice the frame instead of the picture.
Yes.
And we don't want that. It's got to look normal and it's got to be proportional.
Yeah. Well, and Dr. Ward, I mean, we talked about these lines on me that I still to this day hate, but Dr. Ward has been actually trying to help me. And I was born with them, but they're little dimples that essentially it's something that makes me feel uncomfortable, and a little filler, we're trying to help them slowly become a little bit more normal, if that's the key term.
But I think it's so important. Like sometimes people get so focused on one little thing, maybe it's like a line here,
like
or
me
a line here.
With these. Yeah, it's so true.
That if we just keep treating it, then all of a sudden we've created a bigger problem. Like it's important to keep the whole face as a whole.
Yeah.
So whether we are doing filler here or cheek implants or like a chin implant is a hugely popular procedure to give better balance.
Yeah.
Mandibular angle implants to kind of balance out, or maybe like a little tuck where we tighten that to give their proportions better.
Well, and that's what I liked about Dr. Ward is when I said I want filler here, you walked me through and you actually said this filler will be better because it will start to help you produce your own collagen. So fingers crossed, right? If you want to talk with Dr. Ward, also, you can grab your phone right now. There's a QR code on the screen and at least start the conversation with him and his team. Dr. Ward, as always, thank you so much.